Hi, this is Kshamica MD. Many people are thin, and no matter what they eat, stay slim. And they don't exercise that much. We deem these people as lucky, but just because you look slim doesn't mean you're not holding internal fat. In fact, you could well be someone who's known as a TOFI. Thin on the outside, fat on the inside. There are many people who look slim and healthy who are collecting dangerous amounts of internal fat around their organs. Doctors have used MRI body scanners to show that even slim people can still have high levels of internal fat collecting around vital organs, such as the heart, liver, kidneys, and pancreas. These TOFIs, thin on the outside, fat on the inside, could be seriously putting their health at risk. This MRI scan is on a man with a normal BMI. You can see where fat is stored internally in the body by looking at the yellow areas. The yellow is extensive and around all the crucial organs. Muscle is red and external fat is green. It's this fat we can't see that surrounds the vital organs, which is called visceral fat, that could be very dangerous. So it's true, a person who appears overweight can often be far healthier than an individual who looks thin, but whose internal organs are harboring fat. Let's take an extreme of sumo wrestlers. In Japan, sumo wrestlers have been put through MRI scanners to look at where the fat on their body lies. Even though they have a BMI of 56 and are eating up to 5,000 calories a day, they have very little internal fat. They have low cholesterol, they have low insulin resistance, and a low level of triglycerides. Their fat is all stored under the skin on the outside. So, a sumo wrestler may actually be healthier than you. So let's get back to the visceral fat. Visceral fat can cause a host of health conditions. First, visceral fat causes impairments in blood sugar metabolism and causes insulin resistance, which can lead to type 2 diabetes. The next, visceral fat so close to the liver actually goes to the liver and it's broken down there, and LDL, low-density lipoproteins, are created, which circulate around and within the bloodstream. LDL is commonly referred to as bad cholesterol, and this cholesterol builds up as plaques in arteries, and it constricts the blood flow. And this buildup is known as atherosclerosis. Next, there's a direct correlation between a person's waist circumference and their chance of having diabetes and heart disease. A waist circumference of 32 inches for a woman and 37 inches for a man indicates a significantly raised risk of developing heart disease or diabetes. If there's a waist circumference of 35 inches or greater for a woman and 40 inches or greater for a man, it's considered high risk for developing both conditions, heart disease and diabetes. Now, the topic of liposuction. Visceral fat cannot be removed through liposuction. That process removes only the subcutaneous fat of the stomach, which is the fat right underneath the skin, not this bad health-causing fat. Remember, visceral fat is much more metabolically active than subcutaneous fat. It produces more harmful hormones and enzymes, such as interleukin 6, and it suppresses positive ones, such as leptin. It also secretes inflammatory adipokines, such as leukin 6, as I mentioned, macrophage chemoattractant protein 1, it's known as MCP1, and resistin. The thing you need to know is that these components induce insulin resistance, again contributing to diabetes. What is very interesting, though, is that visceral fat is consumed more quickly by the body than subcutaneous fat. So when you do regular exercise, the visceral fat is the first to go. So that's a good thing to know. So how does this happen? How does one acquire visceral fat? A lack of exercise is the biggest factor. If your body isn't moving, it doesn't metabolize the fat that's building up, either outside or inside. The next is diet. If you're eating foods high in saturated fat, such as butter, dairy, animal fats, cakes, biscuits, it's nearly all stored as visceral fat. So, back to thinking of people who eat this way and don't gain weight. Remember, they may not be so lucky after all. So what are other contributors to high visceral fat? Menopause, alcohol, and smoking. During menopause, estrogen levels tend to drop, and it encourages visceral fat to be laid down over the organs. The next, if you drink a lot, it's not good either. The sugar and alcohol, for some reason, it's very prone to settling around the abdomen as visceral fat. And third, smoking. Smokers have higher levels of visceral fat than non-smokers. It's just a correlation, and we're not sure why that happens. So how can you tell if you have high levels of visceral fat? Well, you don't need to have your own MRI scanner or even get your body scanned. Lots of visceral fat will likely show up in the form of high blood pressure and high cholesterol because of the effects it will be having on the rest of your body. But personally, I think that's too late, and you might as well get in the habit of exercising and eating clean to prevent this happening in the first place. See your physician and get your blood checked for health conditions. Also, pay attention to your body shape. Visceral fat collects around the abdomen, so apple-shaped people with large stomachs are more likely than pear-shaped people to be harboring internal fat. So how to reduce it? It's simple. Do basic aerobic exercise for at least 30 minutes 3 times a week. According to a study in the Internal Journal of Obesity, this can reduce visceral fat levels by between 25 and 60%, which is very significant. Also, eat clean. Eat plant-based foods, good fats, and whole grains. Remembering, decreasing your visceral fat lowers your risk of heart disease and liver disease. So, the point is, TOFIs are everywhere. Don't let appearances fool you. This is Kshamica MD from KshamicaMD.com. Thanks for listening.